we need to count health workers as an investment and count what is it we are missing by not investing in the health workforce. The issue of migration, initially we used to say the payment or the wages should be matched with the per capita income in the country, so that even doctors look at how much are they earning relative to the per capita income in the country. But with the globalization and movement, you can no longer say that you're rating their wages against the per capita income in their country, because the per capita incomes globally are open to them, so they can choose where to go. This is a complex situation, but African governments are doing the best they can. Taj talked about the initiative across Africa, CDC, and the African countries that's going to come on the AU resolution to create the Africa Health Workforce Task Team to try and work country by country through compacts to resolve this issue of health workforce. So there's a lot going on. Like, how do we partner with the countries to resolve this problem?
I was listening to various ministers from our countries in Africa, and I realized that the same problem we have in Kenya is like Africa is one in terms of the health problems we have. And that is where we find ourselves. How do we deal with this ever increasing ballooning wage bill in the health space, caused by negotiations by very powerful unions by health workers? I think that is a space we need to look at. As Dr. Nyika said, health financing that needs to be emphasized, so that we have governments spending more on the health space than many other ministries.
We all need to commit our support. So speaking from a GSK perspective, we commit our support as partners in global health. It's a cornerstone of our social responsibility and ensuring sustainable development. The reason why is we understand the importance of a strong, resilient health system with appropriately trained, numbered and remunerated and valued health workers, because without those individuals, the medicines and vaccines that we create will never get to the people who need them.
I think that we've learned a couple lessons about what we think is important. I shared multi-year as a partner matters immensely. And that also, by the way, to the funders. You need to please fund in multi-year unrestricted tranches so that we are able to partner with our governments in order to do the kind of investments that are needed to be transformational and to see these returns.
I think the first step towards having more impact with the resources we have today is to first start with one national strategic plan around health workforce that's grounded in the evidence of what's going to drive the largest changes in morbidity and mortality, and fully owned by the government. But that's not enough. The second step is to move to detailed costed plans and prioritization, because everyone has acknowledged, starting with the ministers, that we are in a constrained fiscal space. And then finally is one implementation plan, is that all of this should move from national strategic plan all the way through to implementation. And the minister from Malawi has really, I think, led in having one plan, one budget, and we're trying to do that across a number of countries. So that's on getting more impact within the resources we have today.
Africa CDC, Dr. Taj, laid out 5 principles that I think are the remain core guideposts that I think we all can buy into and the United States is committed to. Those guideposts are: strengthen public health institutions, strengthen the public health workforce, expand local manufacturing, increase domestic resources for health, and have action-oriented, respectful partnerships. And I think what we're demonstrating in these kinds of models that we're describing is our commitment to do that.